In this video, I'm going to talk about muscles of the shoulder, specifically the muscles that act on the scapula. Just to review motions of the scapula, so we talk about elevation when the scapula moves up, depression when the scapula moves down, protraction when the scapula kind of moves forward, and then retraction when the scapula moves back. Protraction and retraction are also known as ab and adduction, and I know in the trail guide book they use that terminology, and I think Kendall uses that terminology as well. I will use protraction and retraction. One, it's a little less confusing, I think, for students to have, because it is a very different motion from ab and adduction, and so I think it's just better to keep things straight. And also it's more common terminology in the clinic, I think, protraction and retraction. Okay, so again, elevation, depression, protraction, and retraction. Another motion that we'll mention is something called scapular rotation, and I want to emphasize that scapular rotation is not like rotation anywhere else in the body. Typically when we use the term rotation in terms of a joint, it's movement in the horizontal plane around a vertical axis. So this is rotation, this is rotation, this is rotation, okay? Scapular rotation is not that. What scapular rotation refers to is the way the scapula moves. You can imagine my hands as your two scapulas on your back, how it sort of moves, you know, up and down on the thorax, okay? So specifically, here's a scapula, okay? So this would be posteriorly the right scapula, okay? And remember that this is the inferior angle, the lateral angle, and the superior angle. The medial border is here. When we talk about upward and downward rotation, it's specifically defined by where the inferior angle moves. Okay, so if the inferior angle moves laterally, okay, that would be upward rotation, and that typically is seen as the humerus goes over your head, an abduction, or maybe even an abduction or flexion. And then downward rotation is that inferior angle moving medially, okay, so towards the midline, and that happens when you bring your arm back down, okay. So when your arm comes up, when your arms come up over your head, your scapulars are going to upwardly rotate, okay. So if you can imagine kind of the bottom of my hand, my wrist, as your inferior angle, okay. In normal abduction, normal movement of bringing your hand over your head, you're going to have that upward rotation. And again, that upward rotation is defined as the inferior angle moving laterally. Conversely, downward rotation is that inferior angle moving medially, okay, which normally happens when you bring your arms down, okay. So again, it's all about how that inferior angle moves. It's very important that you remember that, because when we talk about what muscles do what, sometimes it seems a little counterintuitive. Okay, because it's really just how that muscle pulls on the scapula is going to depend on whether it upwardly or downwardly rotates. Okay, so again, it's all about how does that inferior angle move. Don't worry about anything else because you'll confuse yourself. Okay. The other thing I want to mention in terms of scapular rotation is that, you know, protraction and retraction, elevation and depression, those pretty much you can just, on yourself, you can see they really don't have anything to do with the humerus, right? They're really driven by, you know, this movement of the scapula. My humerus is moving, but it's not really a part of that movement, right? It just kind of comes along for the ride. But upward and downward rotation, that is very closely associated with movement of the humerus, and you can't do it independent of humerus movement, okay? So, you know, you can't have the scapula moving up or down without the humerus moving as well, okay? So it's really part of the overall movement of the humerus, okay? So those are the movements of the scapula. There's three muscles kind of on the posterior side that we'll talk about, the levator scapulae, the rhomboids, and the trapezius. And then there's kind of two more on the anterior side, the Pec Minor and the Serratus. And the scapular muscles are really important to keep the scapula stable. And as I mentioned in the previous video, movement of the humerus is really dependent on a stable scapula. Okay, you're not going to have what you might say this distal mobility. You don't have this proximal stability. Okay, and there are a lot of problems, a lot of pathology of people's shoulders has nothing to do with the humerus. Okay, it all has to do with more of this proximal activity. All right, so the levator scapula comes from the transverse processes of 1 to 4 cervical vertebrae, and it's going to insert on kind of the medial part of the superior angle of the scapula. It's going to elevate the scapula, so you should be able to kind of visualize it kind of coming on the side here. Okay, so it's going to pull the scapula up. It also has a movement at the head and the neck, but I'm not really going to talk about that now. And it can also downwardly rotate the scapula, and I'll talk about that in a minute. Just to mention about, there are muscles, especially the scapular muscles and some of the shoulder muscles even, are going to come from parts of the spine. The two main bony landmarks that I'll reference are the transverse processes, and those are these guys sticking out on the side, and the spinous processes, and these are these guys sticking straight out. Okay, so spinous processes, that's the part of the vertebrae that comes straight out. They change a little bit in direction, but they're right in the middle. The transverse processes are on the side, okay, and those are the most common things that we'll reference in terms of the spine. Levator scapula is innervated by nerves off the cervical plexus and the dorsal scapular nerve. Rhomboids are actually Rhomboids minor and Rhomboids major, and they're going to come from about, the Rhomboids minor is a little bit higher, and that's going to be from C7, T1, and come to about the root of the spine here of the scapula. Rhomboids major goes from T2 to about T5, and that's going to come to the medial border of the scapula. So combined, they're kind of going to come from C, this E7 to about T5, and they're going to kind of fill in that medial border of the scapula, kind of from the spine to the end. Okay, so this is about kind of their direction of fibers. All right. So they're going to pull the scapula up, they're going to elevate, they're also going to retract. Okay, so you should be able to see how coming from the middle of the spine here to the scapula, they can pull the scapula in or pull it medially, which would be retraction. And the nerve is also dorsal scapular, so similar to levator scapular. And similar to levator scapular, they're also going to downwardly rotate the scapula. Now I know you're saying, okay, how can they elevate the scapula but downwardly rotate the scapula? How is that possible? So again, remember how we defined downward rotation or upward rotation. It's all in terms of where the inferior angle goes. So if a muscle can make the inferior angle go laterally, okay, it's going to be an upward rotator. If it can make the inferior angle go medially, it's going to be a downward rotator. And that doesn't necessarily have anything to do with whether it elevates or depresses. It all depends on what part of the scapula it's going to pull on. So the levator scapula, remember, is going to come from the kind of this medial, upper medial part. So when it pulls at the angle on the kind of this medial part, it's going to pull this inferior angle as well medially, okay, which is going to be downward rotation. And the rhomboids is the same thing, okay. It's still going to have kind of this medial pull, and that medial pull is going to pull that inferior angle medially, which is downward rotation, okay. Again, it's the kind of thing in the lab you'll want to play with the scapula, with the skeleton, and kind of be able to work it out for yourself. Just remember, when you talk about rotation, it's just all about how it happens to pull it, okay? And it doesn't necessarily have to go with elevation or depression. All right, so moving on is the trapezius. So the trapezius is a really large muscle, okay? It's basically a giant triangle. The muscle as a whole starts from up in the head, from the external occipital protuberance, which is kind of a bump in the back of your head, the medial portion of superior nuchal line, kind of imaginary line in the back of your head, ligamentum nochae, which is a ligamentum structure, which obviously you can't see here, but you're just going to have to imagine it's going to be right here. And then from about C7 all the way down to about T12 of the spinous processes. So all the way up in the head to really almost your low back. All right, those are all the origins of the trapezius. All right, it's going to insert onto the spine of the scapula, the acromion, and the lateral third of the clavicle. All right, so again, it's kind of, it's really too big for a string, but from here to here to here. So kind of this giant triangle. The trapezius, aside from moving the scapula, also has actions at the head, which I'm not really going to talk about now. Basically, it can laterally flex and rotate. I'm just going to focus on the scapula. But I do want to say that when it acts on the head, it really does act as one big muscle to perform those actions. When we talk about the trapezius for the scapula, it actually acts as three different muscles, three pretty distinct muscles. So again, like I said, if you can envision kind of a giant triangle here, okay, we typically talk about the upper trapezius, which is going to come from the head to maybe about, you know, C7, T1, okay, so that's kind of this little upper triangle. And then we talk about the middle trapezius, which I would say maybe starts around T1, T2, maybe down to like T5, okay, so it's almost like a rectangle really, kind of coming out straight across. And then we talk about a lower trapezius, which is kind of a bottom triangle, you know, so that's the rest of it, maybe maybe T6, T7 down to T12, okay? But they all insert in the same spot, right? They're all gonna come to this lateral third of the clavicle, the acromion, and the spine of the scapula. So the upper trapezius, this kind of upper triangle here, right? That line of pull is basically gonna be, if you kind of put it from the top of the head, it's gonna be like this, okay? So it's going to elevate the scapula, right? Kind of like the levator scap, it's going to pull it up, okay? It's also going to upwardly rotate the scapula. Again, its insertion spot here is lateral. So when it pulls up, it's going to pull, it's going to tend to pull this inferior angle laterally, all right? So that's the upper trapezius. The middle trapezius is going to go straight across, all right? So it's in a perfect position to retract, okay, to pull the scapula towards the spine. So it's your primary retractor. And in the lower trapezius, okay, it basically has a line of pull like this. Okay, so from the spine going up. So it's going to pull the scapula down. It's going to be a depressor. It's also going to upwardly rotate the scapula. Both the upper trapezius and the lower trapezius upwardly rotate the scapula. And again, it's one of those things that students find really confusing, and I recommend that you spend some time with it with a skeleton. But the way to think about it is that even though this is coming down, remember it's coming all the way up here. So when it pulls, it's still going to pull the scapula kind of in a lateral direction. So it's going to pull the scapula in a way, even though it's coming down, because it has kind of this lateral insertion spot, this inferior angle is still going to go laterally. So it's still an upward rotator, even though it's a depressor. Okay, again, you're just going to have to play with it. The nerve for the trapezius is the spinal accessory nerve, which is actually a cranial nerve, and it also gets some input from the cervical plexus as well. So that's the scapular muscles that kind of act on the posterior side. Coming to the other side, you have Pec Minor, which comes from ribs 3, 4, and 5, and then comes onto the coracoid process. So it's kind of like this. It's a relatively small muscle. It's primary, it's in the best position to actually anteriorly tilt the scapula. So kind of just pull the scapula forward, which is not really a big motion. I know the trail guide book lists it as a protractor. It's not a very big protractor. That's not a reference that you'll see a lot of other places. So I just talk about it tilting the scapula. And the nerve is the medial pectoral nerve. The other muscle on the anterior side is Serratus Anterior. That comes from the surfaces of the 9 ribs here, and it's going to come onto the anterior part of the medial border. So it's a little hard to kind of do a string through here. But so you have to imagine it coming from here, from kind of the anterior lateral part of your chest here, and then it's going to insert up in here. So on the medial border on the anterior side, okay? The primary role of the serratus anterior is to protract the scapula, okay? It's really your only protractor. And even more importantly, just to hold the scapula on the thorax. So in the previous video, when I talked about the joints of the shoulder and kind of the overall structure of the shoulder, one of the things I emphasize is how important the scapula is to function, and how really it just sits on the thorax. Nothing really holds it on there but soft tissue. It's really dependent on muscle for its position, and if it's not in the right position, a lot of problems can ensue. So the serratus anterior is the only muscle really in position to kind of hug that scapula onto the thorax. If you don't have a stable scapula on the thorax, your larger mobilizers of the glenohumeral joint, when they go, a lot of them come from the scapula, come from that region. When they go to pull the humerus up, if it's not stable, then instead of the humerus moving, the scapula is going to kind of move, and you're not going to get a good movement. All right. So it's really key that you have these scapular stabilizers, and the serratus anterior is one of the most important to kind of hold that scapula on. And the nerve for the serratus anterior is the long thoracic. Okay, so again, you have the serratus anterior on this side, you have the pec minor. Another mention with the serratus and the pec minor, and this is true for any muscle, whether it's primarily the head or the neck or the shoulder, any muscle that has any kind of attachment to the chest or even the clavicle, but especially the ribs, can play a role in respiration. I'm not really going to talk about that here, but it's definitely a possibility. So it's something to keep in mind. And those are the muscles of the scapula.